Hello and welcome to this new session in our Bone Matters series. And today we're talking about family history as a risk factor for osteoporosis and for fractures, for broken bones. So what does it mean? How important is it? And if it relates to you, how can knowing about your family history mean that you can turn it really into positive actions for your bone health? I do know that it's very common for people to feel quite frustrated if they've got osteoporosis, if they've got weaker bones, and perhaps they've lived a really healthy lifestyle for their bones and they really can't understand why it's happening to them. So I think this exploration of genes and genetic makeup and how that plays a part will be really helpful. And I'm delighted to be joined by Professor Stuart Ralston, who's a doctor and a researcher in the field. And we're going to be discussing this topic together. So perhaps I could start, Professor Ralston, by asking you just to introduce yourself, tell us a bit about your work and your role.
Yeah, sure. Thanks for inviting me on this afternoon. Yeah, so I am a doctor, I'm a rheumatologist, and I am lead in Edinburgh for the osteoporosis service. So I see a lot of people with osteoporosis and have had those conversations which you've just described about why on earth have I got osteoporosis because I have such a healthy lifestyle. So hopefully I can answer some of the issues that the viewers might be interested in today.
So family history, as I say, it's something that comes up quite often. People know about genes and family links with medical conditions. And indeed, in our own risk checker, that's the questionnaire on our website, it does ask whether one of your parents has had a broken hip, has had a hip fracture. And we've been asked to start really by explaining this a bit more. Why does your mother or father breaking their hip mean it's more likely that it's going to happen to you? So maybe you could explain that a bit, Professor.
Sure. Well, there have been several studies looking at this, and it's known that parental history of hip fracture is a risk factor for you having a hip osteoporosis earlier in life. It's not only parental, actually. There was another study I can recall from Aberdeen which showed that if your grandparent had a hip fracture, that was also a risk. Less is known about not having osteoporosis, but it's not a hip fracture, and it's because it's more difficult to study. We know that osteoporosis is missed in many cases, as a diagnosis isn't made, but there is information that if in your medical record there is, or your parents' medical record, there's a history of osteoporosis, that is also a risk of you having osteoporosis. So it's not just hip fracture; it goes beyond that, I think.
And in terms of the hip fracture, we do get asked, what about the age? You know, my parents had a hip fracture when they were very old and frail. Is that still relevant?
Yes, definitely. I mean, younger people don't often suffer hip fracture. I think the average age is about 80 for a hip fracture. So yes, even if your parent had a hip fracture later in life, which is the norm, that puts you at increased risk.
Thank you. That's helpful. And you were talking a bit about other types of osteoporosis and other types of fractures and how they may indicate you have a risk. So I assume by that you're including things like spinal fractures. People talk about my mother or father had a very curved back. I mean, is that relevant? I mean, we know that arthritis does that too. Is that a helpful sign?
Yeah, well, I would have said so. And week in, week out, I see patients at my clinic with spine fractures or vertebral fractures, and often occurring without much trauma. And a significant proportion say, well, actually, my mother had this. You know, she had terrible osteoporosis and her back was curved over. I mean, there are other conditions that can cause curvature of the back, but I think osteoporosis is the most important. So I think that's something that is definitely needs to be taken into account. And although it's more difficult to do using some of the calculators that doctors use that will advise you, but there certainly is one calculator that will take parental history of osteoporosis into account and not just hip fracture.
Right, thank you. So let's talk a bit more about genes. Is this a genetic link we're talking about? I know we always talk about your risk of osteoporosis perhaps being 80% down to your genetic makeup. And so is that true? And I guess the second question is, well, is there a test people can have?
Okay, I think it is true. Genetic factors play quite an important role in in regulating bone density. And of course, people with osteoporosis have low bone density, so that is true. There have been a lot of advances in recent years in finding the gene variants that predispose to that. I think at the latest count there were well more than 500, so there's a lot of them. But where we are just now, I don't think we're at a place where you could go to your doctor and have a genetic test to determine how much at risk you were. Although people have been exploring that possibility, whether you could have a test, then you could have a DEXA, but it's not in clinical practice at the moment. But who knows? With future developments, it may be in the future.
Thank you. And I'm thinking too about body type. I mean, we know that some people have a smaller frame. Is that something that runs in families, and is that part of the risk? We know people who are lower body weight and smaller may have a greater risk.
Yes, it is, and bone density tracks very, very closely with body frame and body size. So if you're very, very thin, you are going to be at increased risk of osteoporosis. Whether you're thin because that's your genetic makeup, or whether you're thin maybe because you've not been able to eat very well. Yeah, but that's an important factor, undoubtedly.
The other thing we talked about was other medical conditions, and obviously they can have a genetic component. And is that a sort of indirect link that's important? Perhaps you could talk a bit about that.
Yeah, it could be. I mean, there are so many medical conditions that can predispose to osteoporosis. Sometimes the predisposition is because the treatment of that medical condition can cause osteoporosis. The most obvious, or the most obvious one that comes to mind, is inflammatory diseases like rheumatoid arthritis or inflammatory bowel disease. And patients often need steroids because of that, and that can cause osteoporosis. So it's quite difficult to figure out whether it's a link with a disease or it's a link with a treatment. Celiac disease is another one. It's strongly genetically determined, quite a common cause of osteoporosis. And so it's a complex situation. Of course, there's so many diseases that and their treatments that can be associated with osteoporosis. It's quite difficult to figure out, to be quite honest.
Yes. And I think the most important thing people want to know is, well, what can I do? So on the positive side, people get very upset if they see a parent badly affected, quite understandably, by fractures, and they want to avoid it happening. Of course, if it happened to your parents, it's not necessarily going to happen in the same way to you. And as you say, there may be another underlying reason why a family member had osteoporosis. But nevertheless, people say, well, should I go and get a check when I'm younger? Is that something I should do? Have a bone density scan? How can you help in that situation?
Okay, well, I mean, it is true that parental history is relevant, but remember, you get two sets of genes, one from your mother and one from your father. So osteoporosis is very seldom inherited directly, like from your mother. It's much more complex than that. I think if you're concerned about osteoporosis because of a family history and you may have other lifestyle factors, it is possible then to go to your GP or the ROS. I know the ROS has a risk checker on the website. It's possible to go to your GP and explain the situation and ask for a risk assessment to be done. And that can be done, not a DEXA, but it can give an idea of whether the next step should be a DEXA. So in all the guidelines that doctors use, they say, yes, you should do a risk assessment based on risk factors like family history. And depending on what level that comes up with, then maybe the next step can be a DEXA. Regarding the age at doing it, I think wouldn't be much point in your 20s, 30s, or 40s, but around about the time of the menopause, late 40s, 50s, I think that would be the time when it would be most appropriate to do it. Because if you were found to be at increased risk or low bone density, then there's various treatments that can be offered, hormone replacement, for example, and many others.
And presumably the same for men too, so about that age, around 50 and beyond that, when presumably bones tend to get weaker anyway.
Exactly. So that's when you start losing bone. And what we know, men and women, between the age of about 25 to about late 45 or so, things are pretty static. Bone isn't being gained or lost, but above the age of 45, then you start to lose bone. And then that would be the point at which some intervention may be offered, let's say.
Thank you. And let's talk a bit more about positive actions. So I'm thinking of both lifestyle changes and possibly managing other medical conditions. Do you want to say a little bit about that?
Yeah, Well, many things can predispose to osteoporosis. To list but a few: too much alcohol, smoking, not doing enough exercise. So all of those things are positive things that people can do to try and maintain bone health. Though if you are found to be at high risk through a fracture score and you have and you get a DEXA and it shows osteoporosis, then mainly we're talking about some kind of medication to try and reduce bone loss. And I do see patients that say, but but I'm going to the gym, and I'm eating well, and I'm not smoking, and I don't drink alcohol. But certainly in women after the menopause, bone is lost, even though you've got the healthiest lifestyle. So sometimes treatment may be required depending on the level of risk.
Research. So I know this is very much your area too. So genetic research. We don't have a test at the moment, and you say no, nothing in the immediate future. But we hear a lot about personalised medicine, and I wonder if you could tell us a little bit more about work that's going on in the research field, perhaps to tailor medicines and find the right one for people.
Sure. There hasn't been all that much done along these lines until recently, but we've recently, the research group here in Edinburgh, we've recently been looking at genetic markers that can maybe predict the response to a medicine called parathyroid hormone, or teriparatide, and it's a medicine that's used in people with severe osteoporosis. And what we found is there is one in particular genetic marker that will tell you if you're going to be a really good responder to teriparatide or not such a good responder. And I mean, teriparatide is a good treatment, but whether even in the poorish responders still works. But that could give the doctor and maybe the patient an indication of whether that might be the best treatment for you, or whether another what's called anabolic or another therapy that could cause gain of bone might be an alternative. So yeah, so there are some movements along those lines, and hopefully more will come in the future.
So something to look forward to, and
Yeah.
we'll wait to hear more.
So hello, I'm Kirsty. I'm one of the specialist nurses at the ROS, and today I'm joined by Janet Boyd, who is a person who is affected by having a parent with osteoporosis, a family history of osteoporosis. And today we're going to talk about how having that family history has affected Janet and maybe influenced some of her decisions about her own bone health. So welcome, Janet. Thank you ever so much for coming to talk to us today. If we can start, could you maybe tell us a little bit about your parents' experience with osteoporosis and fractures?
Yes, both my parents had hip fractures in their 80s through falling over, simple trips and falls at home. My dad was the first one to fracture his hip. He had emphysema and Parkinson's disease, so he was unsteady on his feet anyway. He was in quite poor health. And he just had a simple trip when he went out to collect milk from the front doorstep, something which my mum used to nag him continually not to do because she liked to do it. But he would insist, and he fell, was admitted to hospital, and it was a fractured hip that he had. And unfortunately, he had surgery the day after to repair it, but unfortunately he died as a result of the surgery. So I think his complex health issues probably contributed to the fact that he did fracture his hip. And then after my dad's death, my mum moved into sheltered accommodation to live closer to me. And she lived there for a couple of years fairly independently. She did have vascular dementia, but it wasn't at an advanced stage at that point. But unfortunately, after those 2 years, she was getting up out of the chair to make a cup of tea, and she fell and she fractured her hip. So obviously she was admitted to hospital. She had the surgery, which went fine, but she never regained her mobility after it, despite having rehabilitation. She spent a while in a rehabilitation centre. She was just unable to regain her mobility. And at the time, I remember it was really stressful. I had a young family, I had young children. Husband was working away from home a lot. I was working as a teacher. So it was a very difficult decision, but we took the decision that she would move into residential nursing care, which is where she lived for the final 4 years of her life. But obviously having the fracture reduced the quality of her life massively, the fact that she didn't have mobility, and her dementia began to advance quite significantly during that time. Neither of my parents at that point, because we're talking now around 10 to 14 years ago when this happened, neither of my parents had a formal diagnosis of osteoporosis that I was aware of. Although I do remember my dad taking calcium tablets, which were probably prescribed because he had the Parkinson's disease.
Right, yeah, okay. So it was never really spoken of at that time?
No,
Yeah.
not at all.
Okay.
No.
So you said you have subsequently then looked into your own bone health. So what led you to do that, and what happened there?
Well, I never suspected that my parents had osteoporosis. I was aware of osteoporosis as a condition, but I didn't really link up the fact that they'd had hip fractures to the fact that they could have potentially had it. So it was a number of years later, it was probably a good 10 to 12 years after they died, that I was reading a newspaper article one day about osteoporosis. And in the article, it said that if one of your parents had had a hip fracture, it could be a risk factor for you having it, as well as having quite low body weight, which I've always been slim and quite slight built, as were both my parents. So I thought, oh, right, next time I go to the GP for a general appointment, I might ask about that just to find out, because I began to wonder, did they actually have it? So it was a couple of months after that, I was at the GP's for something else. So I just asked her, and she asked me a few questions about lifestyle and things. And she said, yeah, I'll put you through for it because it is a risk factor. I'll submit the fact that, you know, your parents both had hip fractures, but I doubt you'll get a scan on the NHS. You'll probably have to go privately. But anyway, lucky for me, it was agreed. So I did have a DEXA scan to measure my bone density, but I still didn't suspect at all that I would have osteoporosis because I've always eaten a fairly healthy diet, and whether I've wanted to or not, I've forced myself over the years to be a regular gym goer. You know, I've tried to keep healthy. So I wasn't worried at all. I thought, oh, I won't have it. And to my shock, when I got the scan results via the GP, I was diagnosed with the condition, not in my hips, but just into the osteoporotic range in my spine.
Okay.
So that's how I found out that I then had it, and that's when I then connected back and thought, I suspect there's a pretty strong link with that both my parents also had it, which is probably why I've got it, because of that genetic link.
Yeah, yeah, absolutely. So in terms of how you've then made decisions about what to do about your bone health, has that knowledge about having that family history affected anything you've decided to do or decided not to do?
Yes, I think it has really, because especially with it being both parents. I mean, I'm very fortunate that you know, touch wood, I've not had a fracture, and quite often people, from what I'm aware of, aren't diagnosed with the condition until they do have a fracture. So at least I do know that I've got it. I have fallen over since then, and I've been absolutely fine. So I'm not as panicky as you might be, being told that, and it's still a horrible thing to be told. But I feel fortunate that I know, so there's things that I can do about it. So after lengthy discussions with my GP and getting lots of advice from the ROS as well, I do take calcium supplements. I'm already on HRT, which I know can help protect your bones, which is a real positive for me. My overall risk of fracture is still under 10%. So at the moment, I've opted I'm not on any other medication, but that's not something I wouldn't discount doing that in the future. I'll be doing another DEXA scan next year, so we'll see what the results of that is. But I also feel it's almost like, I'm not a golden ticket because nobody wants to have osteoporosis, but when you know you can do things. So I make sure that particularly since I finished, I was lucky enough to get early retirement from teaching about a year ago. So since then, I've also been able to increase the amount of exercise that I do. So I'm there at the local gym, twirling around the dance floor, doing Zumba classes and dance aerobics, which is great. I do walks every day for a good sort of half an hour, 40 minutes, which again, I know is good for bone health. And I also do Pilates regularly, which again, I know is good for core stability and to help maintain balance. So I do all of those things. I also am more careful with my diet. I've never eaten a bad diet, but I'm just a little bit more aware now. So I do really try and make sure that I get as much calcium as possible from my diet. Vitamin D, I take those supplements as well, along with the calcium supplements. So I think, yes, it has had an impact. Perhaps if my parents hadn't, I would have probably still done things, but I think it's given me that extra push to make sure that I'm doing as much. So at least I know that I'm doing as much as I can currently to try and protect the bone health.
Yeah, it's really heightened your awareness then.
Yes. Yeah.
And do you think if osteoporosis had been mentioned back when your parents both experienced their fractures, do you think you would have done anything differently at all, or?
We probably would have done. I mean, I probably would have been too young at that point really to consider things like a DEXA scan. I hadn't gone through the menopause at that point. But yes, I probably would have done. Probably would have looked more carefully at the exercise I was doing at the gym and done more impact kind of exercise. I probably would have tried. It's hard when you're working full time. I know it's not easy to fit all of these things in, and you've got to be realistic, and you've got to do things that are, are realistic and achievable for you, because you can't beat yourself up if you can't go out and do an hour's run every day. So yes, I probably would have done. I probably would have made sure I did more impact exercises and been a bit more careful with my diet. Definitely.
Yeah, absolutely.
Yeah.
But it sounds like you've still been very, very aware of those things anyway, which is
yes,
your bones. Yeah.
Yes.
Brilliant.
Yeah.
And in terms of how you feel about all of this now, have you got any particular messages that you would pass on to other people that perhaps might be finding themselves in a similar situation?
I would say, first of all, don't panic. Because there are things that you can do. Okay, you may, if it does turn out that you do have osteoporosis through a genetic link, there's still things that you can do to help ensure, or to help to try and protect your bones. But I think the first step really is to find out your risks. Are you at risk? So the ROS has a fantastic range of information. So you can do their risk checker to find out whether you do have a risk. And you can also phone the nurse helpline, talk it through with them. If you are concerned and you do have any of those risk factors, like the potential genetic link, then speak to your GP as well, get advice from them. Because I think if you have just been diagnosed with it because perhaps one of your parents had a hip fracture, again, don't panic, because I think when I received my diagnosis, I felt very alone, really, because I was in my early 50s. I didn't know anybody else that had it, and I had the preconception, which was wrong, that osteoporosis is something that really old people get, and it's women that get it. And I know now, obviously, since then, that that's totally untrue. Men can get it, and it's not obviously more mature ladies, to put it politely. They are more likely postmenopausal to have it. But I think that was that was what was difficult for me, being in my early 50s and feeling that nobody else I knew had the condition. So things like, again, the ROS is great, that they have obviously all the support groups that you have there. You can go and speak to people. If peer support is something that you feel will benefit you, which I like, then go to a support group meeting. They're all over the country. Or I know there's a variety of Facebook groups. I think you could join some of those and get peer-to-peer support there. So you're not alone, really. I think it's get help, get advice, and there's things you can do, like the things that I've already been doing, to try and help prevent your bone health getting any worse.
Absolutely, that's really useful. And I think it's just taking the time to find out the information, to feel like you're making an informed decision about what to do, and what to think about, and maybe what to change. That's really important, and that guidance from other people, like you say, with peer support, can be really valuable. Absolutely. Oh, that's really, really useful discussion. I think that's probably touched on an awful lot of points that there's probably lots and lots of people out there who are considering, might this be me? So I think that's going to be a really useful discussion for people to listen to. Thank you so much for coming to talk to us today. That's wonderful.
You're welcome. Thank you.